3 days will be crucial for Ontario doctors as two important issues are discussed in the Ontario Divisional Court concerning the protection of physicians' conscience. To explain this case some more, I'm joined by David Guretzki, theologian and Executive Vice President of the Evangelical Fellowship of Canada, who served as an expert witness in both cases. Thank you for joining us today, David.
Thanks for having me. Glad to be here.
So as I mentioned, 3-day hearing starts today in two cases between the Christian Medical and Dental Society and the College of Physicians and Surgeons of Ontario. Tell us about this.
Well, Maggie, both of these cases are essentially about whether the government can compel physicians to violate their consciences or sincerely held religious beliefs. And both of these cases stem from relatively recently adopted policies that the College of Physicians adopted that speak to physicians and in requests from patients on how physicians are supposed to be dealing with patients. The first case is really about professional obligations and human rights, and it specifically tells us about how a physician is obligated to prescribe the various procedures or pharmaceuticals to patients. And the second case is a policy based on how physicians in Ontario are being directed to regard their involvement with what the college is calling medical assistance in dying, or what we've been calling physician-assisted suicide.
And
in both of those,
go ahead.
In both those cases, the complainants, the medical Christian Medical Dental Society and several Catholic and Protestant physicians have argued that their right to refrain from participating in certain procedures due to religious beliefs and matters of conscience is being challenged.
And the College of Physicians and Surgeons have also adopted two new policy points when it comes to the issue concerning physicians. Tell us about this.
Well, in those two policy documents, a statement is made to accommodate the physicians from certain prescribing and procedures based on their conscience or religion. But both policies then go on to assert that under certain circumstances, a physician who might be unwilling to provide that procedure or pharmaceutical for reasons of conscience or religion will have to make effective referral to another healthcare provider or physician for the patient. And in this case, effective referral primarily just means that physicians are able to decline from participating directly in the procedure, but they're being forced to take extra steps to make sure that the patient knows all of the options and that the patient is actually lined up with someone who will do the procedure.
Now, the Christian Medical and Dental Society indicates that these two new policies violate religious freedoms, freedom of conscience, and equality for doctors. How?
Well, in their policies, the college does acknowledge that the Charter of Rights, the Canadian Charter of Rights and Freedoms, protects the freedom of conscience and religion. That's under Article 2. But the policies go on to assert that no rights are absolute, and certainly the Supreme Court has ruled in that. And the right to freedom and conscience of religion might need to be limited to protect safety and the rights of the patient. So the physicians are arguing they're being asked to participate even in a secondhand or a removed way in procedures that they might find morally objectionable or against their own religious convictions. And so here, it's not just about religion per se, or even about Christians per se. The policy affects even doctors who may not have any religious affiliation at all, but who have moral objections to participating in certain kinds of procedures. So there might even be atheists who think that maybe assisted suicide or abortion is wrong, but they too would be affected by these policies.
And the feeling is that this forces physicians to participate in something that is contrary to their beliefs, essentially.
Yeah, that's right. And the requirement for physicians, especially to provide effective referral, is of particular concern because it basically means a doctor has to be able to refuse to participate in a procedure, such as an abortion or physically assisted suicide, but they're nevertheless required to go on and find someone who will do the procedure. And so the ethical issue here is that it forces the doctor to help someone else do something that the doctor, that he or she is unwilling to do. So a doctor may feel that an abortion or particularly assisted death is morally wrong. The policies are written in such a way that they still need to be, what I'm calling an aider or an abettor to the act. So here it might be good to have an illustration where you and I might feel that committing suicide is a morally wrong thing, and that if a friend came and said, would you do it for me?" We'd obviously be compelled to refuse. But if the friend said to you, "Well, will you go and buy a gun or get me some poison?" We'd certainly refuse that as well, because even though we're not directly causing the death, we'd be feeling that we're morally aiding the person in doing something that we know is wrong. So in short, the case really is about doctors being able to stand 100% of the time on their ethical and religious and moral convictions.
And David, we have seconds left. Actually, we're kind of over time, but I do want to get this one question out, and that is what's next, and what can Canadians do about this?
Well, the EFC has been working with the Coalition for Healthcare to ask the Ontario government to provide protection for healthcare workers. In Ontario, that bill already passed without protection, but fortunately, in Manitoba, Bill 34 is still being debated. So Manitobans in particular can contact their MLAs and ask them to support healthcare workers and conscience rights. And of course, keep praying.
Yes. Thank you very much, David, for your time.
Thanks so much.